Good morning, all. Last class we learned about cephalometrics, various cephalometric landmarks, and Downs analysis. Today we'll be dealing with the second analysis, which is Steiner's analysis. Steiner's analysis was developed and promoted by Cecil Steiner in the year 1953. So actually it has got three parts: skeletal analysis, dental analysis, and soft tissue analysis. So skeletal analysis which relates the upper and lower jaws to the skull and to each other. In dental analysis, it relates the upper and lower incisors to their respective jaws and to each other. In the soft tissue analysis, which provides a means of assessing the balance and harmony of the lower facial profile. These are the planes used by Steiner in Steiner's analysis. There are four planes: SN plane, palatal plane, occlusal plane, and the mandibular plane. Next, coming to the skeletal analysis, the first angle is SNA angle. The SNA angle is an angle which is formed between SN plane and a line connecting nasion and point A, which represents the antero-posterior position of the maxilla in relation to the cranial base. And its normal value is 82 plus or minus 2. The value, SNA value, which is more than 84 is considered as prognathic maxilla. And if it is less than 80, it is considered as retrognathic maxilla. So the SNA angle represents the relative position of the maxilla to the cranial base, whether the maxilla is prognathic or retrognathic or it is normal in relation to the cranial base. The second one is SNB angle. The SNB angle, which represents the antero-posterior position of the mandible to the cranial base. So, which is an angle formed between SN plane and a line connecting nasion and point B. The normal value of the SNB angle is 82 plus or minus 2. So any value which is more than 82 is considered as prognathic mandible, and the value which is less than 78 is considered as retrognathic mandible. So the SNB angle shows the relative position of the mandible to the cranial base, whether the mandible is retrognathic, prognathic, or which is normal in relation to the cranial base. And the third angle is ANB angle. The ANB angle provides the relative position of the maxilla and the mandible to each other in the sagittal plane, and which is formed by the line connecting nasion point A and the nasion point B. So ANB angle is the angle which is formed between the nasion point A line and nasion point B line. The mean value is 2 degree, and the value more than 2 degree indicates a class 2 tendency, and less than 2 degree indicates the class 3 tendency. So greater the value of ANB angle, greater the antero-posterior discrepancy, and greater will be the difficulty in correction. So this is the ANB angle, which is the angle formed between two lines which are nasion point A and nasion point B. So there is a the problem with the ANB angle is which fluctuates with the rotation of the jaws in relation to the cranial base. So as you can see in the picture, whenever there is a clockwise rotation of the jaw, there will be an increase in the ANB angle. And whenever there is an anti-clockwise rotation of the jaws, there will be a decrease in the ANB angle. So the ANB angle will vary depending upon the rotation of the jaws. Next, coming to the occlusal plane angle. The occlusal plane angle is formed by the angle between the occlusal plane and the sella nasion plane. The occlusal plane is a plane which is drawn through the region of the overlapping cusps of the first premolars and the first molars. So the angle which is formed between this occlusal plane and the SN plane is called as occlusal plane angle. And the mean value is 14 plus or minus 5. And if the value is less than the normal value, it is considered as a horizontal growth pattern. And if it is more, it is considered as a vertical growth pattern. Next is the mandibular plane angle. The mandibular plane angle is the angle which is formed between the mandibular plane and the SN plane. And the mandibular plane in the Steiner's analysis is a line joining gonion and gnathion. And the mean value is 32 plus or minus 5 degree. So if the value is more or if it is less than the normal, it suggests that there is an unfavorable growth pattern. If the value is less than the normal, it is considered as an horizontal growth pattern. And if it is more, it is considered as a vertical growth pattern. So this is the mandibular plane, which is a line connecting gonion and gnathion. And the angle which is formed between this mandibular plane and the sella gnathion plane is called as the mandibular plane angle. So the skeletal analysis in the Steiner's analysis, the skeletal parameters are SNA angle, which shows the anterior-posterior relationship of the maxilla to the cranial base, SNB angle, which shows the anterior-posterior relationship of the mandible to the cranial base, and the ANB angle, which shows the anterior-posterior relationship of the maxilla to the mandible. Then the occlusal plane and the mandibular plane, both of them shows the growth pattern of the patient. Next, coming to the dental analysis. The dental analysis is carried out under, there are three parameters are there in the dental analysis, which is the maxillary incisor position, mandibular incisor position, and the inter-incisor angle. So coming to the mandibular incisor position, it is the in the mandibular maxillary incisor position, what we check is the relationship of the teeth or the maxillary incisor to the nasion point A line. So there are two types of measurement. One is an angle which measures in degrees, and one is a anterior posterior positioning which measures in the millimeters. So the reading in degrees indicates the relative angular relationship of upper incisor to the NA line. So that is the angle which is formed between the long axis of the maxillary incisor and the nasion point A line. So that is the angular measurement. And the anterior posterior measurement is the anterior posterior position or the distance between the incisal edge of the maxillary incisor and the NA line. So the ideal values are 22 degrees is the angular value and 4 millimeter is the linear measurement. So anything more than this is considered as proclined maxillary incisors. Next, coming to the mandibular incisor position, that is the position of the teeth related to the nasion point B line. Here also, like maxillary incisors, there are two measurements, one in degrees and other in millimeters. The angle which is measured in degrees is the angle is formed between the long axis of the mandibular incisor and the nasion point B line, and the angular value is 25 degree, and the linear measurement is from the incisal edge to the nasion point B line, and which is 4 mm. So anything more than these values is considered as proclined mandibular incisors. Next is the interincisal angle. The interincisal angle relates the relative proclination and retroclination of maxillary and the mandibular incisor. That means interincisal angle shows the whether the maxillary and the mandibular incisors are proclined or retroclined relatively. So that is the angle formed between the long axis of the maxillary incisor and the long axis of the mandibular incisor. And the mean value is 130 degree. So any value which is lesser than this, so the decreased value is considered as proclined incisors, and anything more than this is considered as retroclined incisors. So in the dental analysis, the dental parameters in the Steiner's analysis are maxillary incisor position. There is an angular value and a millimeter value or an anterior posterior value. That is a angle formed between the long axis of the maxillary incisors and the nasion point A line, and the mandibular incisor position. That is the angle formed between the long axis of the mandibular incisor and the nasion point B line. Then the interincisal angle, that is the angle formed between the long axis of the maxillary and the mandibular incisor. All of this shows the whether the maxillary incisor and the mandibular incisors are proclined or retroclined. Next, coming to the soft tissue analysis, the last parameter in the Steiner's analysis. So it is a graphic record of visual observations made in the clinical examination. It includes an appraisal of the adaptation of soft tissue to the bony profile. In Steiner's S-line is considered for the soft tissue analysis. The Steiner's S-line is a line which passes through the middle of S, found by the lower border of the nose to the contour of the chin. So in a well-balanced face, lips should be along the S-line. The lips which are located anterior to the line tends to be protrusive. So as you can see in the picture A, the lips are on the S line. So which shows that the lips are balanced. Whereas in picture B, the lips are ahead of the S line, which shows it is protrusive. And in picture C, the lips are behind the S line. That shows the lips are recessive. So these were the parameters of the Steiner's analysis, that is skeletal parameters, dental parameters, and the soft tissue parameter. So there are some limitations of the Steiner's analysis. That means, as we said earlier, A and B can be affected by the rotation of the jaws. Whenever there is clockwise rotation or counterclockwise rotation, depending upon that, the A and B angle may vary. Like that, if there is a short cranial base which result in backward position of the nasion in relation to the jaws, this increases the A and B angulation. And in long cranial base may lead to the decrease in the A and B angle. So these are the limitations of the Steiner's analysis. I hope you all understood about the Steiner's analysis. So the next class I will be dealing with width appraisal, and we'll just recap again the next class about the Downs analysis, Steiner's analysis, and the width appraisal. Thank you.